Hello and welcome. You're watching Head to Head and I'm Oles Garjuk with UATV. Today, half of all HIV-infected Ukrainians are unaware of their status. Timely testing can fix this and save lives. That's why on the eve of World AIDS Day, a public service event called Don't Be a Child, Get an HIV Test will be held in Kyiv. In this way, the organizers want to encourage people to change so-called childish behavior when it comes to health. To talk more about this, we welcome to the studio today Anastasia Deeva, Executive Director of the NGO 100% Life. Hello and thank you for being with us today.
Hello, thank you for inviting.
It's always a pleasure to have you here. So tell us about this action. Tell us about this Don't Be Shy, Get an HIV Test project.
So first of all, let's start that tomorrow, all over the world, NGOs like ours, patient organization, will join their efforts to fight AIDS. Because we know that International Anti-AIDS Day gather all of the activists to make their efforts on advocacy for non-discrimination and destigmatization of HIV-positive people, but also how to present new approaches to fight this disease. So in Ukraine, we are starting it today. We had a big event presenting the new informative communication campaign that is called Don't Be Child, or don't make it childish actions when it comes to your health, and do the test. Because currently in Ukraine the situation is following that almost 100,000 people don't know about their HIV positive status.
And how many registered cases do we have?
Almost 200,000.
So basically 200,000 cases are registered. These people know about their HIV positive status, but 100,000 more, which is a very troubling figure, do not know about status.
We're living in the world where you have all of the means to protect, to care about your health, because we have antiretroviral treatment that helps you, even knowing that you're an HIV positive person, live long life, healthy life, to make family planning, to give birth to healthy children, and so on and so on.
Yeah, you just cannot transmit the infection to other people, the virus.
Exactly, because if you are on the antiretroviral therapy, your viral load is very, very low, so it won't transmit to other people.
But how fast is the virus spreading around Ukraine? How could we compare Ukraine to Europe, for example?
For now, it's very, very different worlds, if I may say so, because in Europe, again, 10 years ago, all of the programs and policies were introduced, and people who knew their status in 10 years ago, again, started their antiretroviral therapy. So now we can say that only a small percentage of people live with HIV and also, let's say, die from AIDS. But in Ukraine, again, the statistics is kind of very big, and it is because of different factors. First of all, is because people don't really care about how they know about their status. So they are afraid of do the test, and they come to hospital only on the last stage, like third or fourth. They prefer not
to know the truth.
It depends on, again, it depends on different factors why people do not go to testing. Sometimes it's because it's a stereotype that this is a disease and it will put a dot in the end of your life and you will die, but it's not.
And also it can't happen to me.
Yes, again, and because of the stereotypes in the society, because again, the key population groups who are people using drugs, people who have sex with sex men, people who have, let's say, a dangerous type of life, they don't want to come up with these problems because they are afraid that society will put the stigma on them. And that's.
But I was thinking that actually people who are among those who are in this risk groups, they are actually probably, well, maybe not all of them, but many of them, they do get tested, but just regular citizens, so to say, that have regular lifestyle, that I think that maybe they wouldn't think that they can be HIV positive, and they do not go to the hospital or to the medical facilities to perform the test.
We can't divide just people on two different groups. We just need to understand that there are still in the society marginalized group whom we need to help, whom we need to shade the light on their lives, on the needs, on their health care issues, and so on and so on. So we shouldn't, let's say, divide people into these groups. We should just understand how to work with key population groups, or how you call them risk groups, and how to work with general population.
Yes.
Because you are absolutely right that sometimes people do not have all of this information, like how the virus can transmit to other people, how they can test, because sometimes people think that test is something very scary, is something very difficult. But now we know that test, you can start it from the application, like I told you. You can download the application.
Tell us what is the application, yes, because we spoke with you before the interview, and our audience doesn't know about it yet.
Our organization, 100% Live, developed the application for the smartphones that you can download. You can pass the test and know how risky your life is and how you are engaged in the risk groups. You will have the level of this risk, and you will know where you can go for the testing.
So they will provide the addresses, some locations,
the geolocations of it, and that will make your life much easier, because you will know that you will have the testing facility just in your neighborhood. And also about the test, it's very important to understand that this year, 2019, we will have 1 million of free express testing for HIV, and you can come to the testing facility, do the test, and in 15 minutes get your result.
1 million tests next year. Well, basically this is even two times more as the population of the whole country.
Exactly.
Well, the statistics say that in Ukraine, HIV positive case detects in 37 cases out of 100,000, and in Europe it's 5.8 times in 100,000. Don't Ukrainians know the safety measures, how to prevent the infection with HIV, or why these figures are so upsetting? This is already 2018, the end of this year. I mean, people have an easy access to information. I just can't understand why the virus is spreading so fast.
Well, as I told you, we have lots of different factors. The global factor, what is happening in the country. Economical factor, like all of different oblasts and districts, regions have their own specifics in economic, in culture, in social, let's say, background. So education, another thing, because we need to explain to starting from children that what is HIV, how, who can be in the risk group, how to start the safe lifestyle, and so on and so on.
So basically we should start teaching them this from schools.
Of course, because these education measures, they will help to be more confident, to be more conscious, and not to be childish to your own health.
Yeah, to care about your health. That's
exactly.
True.
And early testing is one of the measures that will help you to live your life healthy and long.
Well, speaking about early testing, I do know that you also are working on this HealthLink project, which aims to spread the tests everywhere in all the medical facilities and state hospitals. So now you can require the test from the family doctor and stuff. You are saying that Ukraine is being provided with the millions of tests for the upcoming year. Do people show that the interest in this testing is growing? How do people react when the family doctor is just proposing? Don't you wanna go through the test? Yeah.
So thank you for mentioning our HealthLink project, because it's really innovative and it's really new, because it helps us as a country and us as a patient organization and the government to reach the 90-90-90 targets. 90-90-90 means that 90% of people will be tested and the virus will be identified, their status will be identified. 90 90% of people will get the antiretroviral therapy, and 90% of people will have the zero or very low viral load. So people are becoming more and more conscious about it. People are becoming more open about these new approaches, and because it is becoming much more easier to come to your family doctor, to talk to a doctor whom you trust, a doctor who is customer-oriented, who wants to care about you and who wants to provide you with a very high standard service. You can also come to the facilities like ours, for example, in the medical center of 100% Life.
To have this confidential approach.
Absolutely confidential, absolutely tolerant, and whoever come, we will be happy and glad to help you and support you. So I think that making this area more and more transparent, more open and more tolerant, giving people an opportunity to come, to test, to identify their status and to get the treatment and to live long and healthy life.
Thank you for this comment. Well, I want to mention another statistics by the United Nations World Health Organization's European office that was published just recently, that Ukraine had the highest HIV infection rate in Europe after Russia in 2017. What is the data in for 2018? Did it lower anyhow?
It became better in the sense of testing again. We are measuring the targets of people who are in risk groups and people who has been tested and who had been identified. So we're working on that all the time jointly with the government, because I think that now it is such a unique opportunity when the government, the Ministry of Health, the Center of Public Health is very keen to reach this 90-90-90 targets.
And they do, as far as I know, they do nationalize this program as, I mean, they
of course,
yeah, they make it a state
it's a
program.
national policy. So all of us has to unite our efforts. I mean, patients organization from the NGO, service organization, and healthcare facilities unite their efforts to make joint activities towards reaching these targets, and then we'll have the result.
What is the main driver of spreading HIV around Ukraine? Is it unprotected sex?
Yes, still 60% of cases are related to that.
Okay, if the main driver is unprotected sex, after the person was diagnosed with HIV-positive status, well, this person can go on this antiretroviral therapy, yes. But in case some person had this unprotected sex and really worried about his or her further developments and some health complications, what about this PrEP treatment, this treatment that can prevent you from getting this virus?
Well, I also want to mention that the new approaches also contains the approach that you are not only identified in your status, but also you involve your partners or your relatives, your close ones, to make this testing in work and to be identified. So you're absolutely right that there are different programs and projects that will help to prevent and to work on prevention. That is important, and PrEP is one of them. But also what is important is the willing of person to be open and to engage their partners again and relatives to the testing facilities. That will help on the early stage to identify the virus and to start the treatment. And also we are always saying that people, especially who know that they are living the more risky lifestyle, they have to pass the test more often. Once per 3 months or one per half year, that will be a good prevention of the HIV.
How accurate is this test?
Which one?
HIV test.
The express test?
Well, tell us about different types.
So, no, I just told you about this application. So application is just something that will help you to understand, are you in risk group or not? And then after this, you will see the percentage, the level of your risk group, and where you can go for the testing.
Yeah, but I was speaking about the blood test.
Yes, when you go to the testing, for the express testing, you will do first test, and if it is positive, you will make the second express test, and if it's again positive, your blood, you will be redirected to the lab So let's say the blood test will be done in the lab to examine what is the situation and you're HIV positive, to confirm it or not. So let's say the system of the express testing working really good. It helps us to make it quicker, to make it more effective, and to redirect to other laboratories and facilities if necessary. But also I want to mention that next year we will have the new innovation is oral tests.
Oral tests?
Yes.
How accurate is that?
I will tell it more next year because we didn't present it yet.
So the virus is also in the saliva?
Yes, it will help to identify it as well.
Through the saliva. Well, thank you. Well, in total, as far as I know, according to the same report of the UN World Organization, more than 2 million people are affected by HIV in Europe, and 37 million people, around 37 million people worldwide are infected with HIV. It is almost as much as the population of Ukraine, which is around 42 or so million. Now, since there are a lot of people living with HIV, and the quantity of these people is so high that they could be formed in another country, how does the level of stigma change?
Again, it depends from country to country.
Speaking of Ukraine.
But when we speak about Ukraine, I think that, again, thankfully to patients' organization, to the civil society, we have much more progress in these areas. Because working with discrimination is easier, because discrimination is violation of the human rights. It means that if you have accurate laws, it will help you to fight discrimination. But stigma is different. Stigma is some kind of psychological attitude towards other people. It's somehow how you perceive this person, like an enemy, like something that is very strange to you, someone dangerous, exactly. That is something different. And that is where civil society and activists helps by the educational programs, by actions like ours, for example, that it's not good to be childish towards your health, right?
But just the last question. Are people with HIV status excluded from the society in Ukraine, or the society develops some progress addressing this issue?
I think that society developed much progress in this, because more and more people understand that HIV positive have absolutely equal rights and are absolutely equal members of society.
Well, thank you so much for your valuable comments, and thank you for your contribution into Ukraine's society, health, and healthcare in general. Thank you so much for being a guest today. This was Anastasia Deeva, Executive Director of 100% Life NGO. Thank you for watching Head to Head. I'm Olas Garjuk. Goodbye.